Here are some other drugs acting locally on skin and mucous membrane. Caustic and stereotic agent. Caustic means corrosive, while stereotic means cauterizer. This agent can cause local tissue destruction and desquamation. They are used to remove moles, wart, condylomata, papillomas, and also to destroy horn buds on keratonic lesions. Here are some caustic and stereotic agents: glacial acetic acid, aluminum chloride, gentian violet, potassium hydroxide, and silver nitrate. The next group of agents are the keratolytics, keratoplastic, and anti-seborrheic agents. Keratolytics work by loosening keratin, allowing the stratum corneum to be desquamated, whereas the keratoplastic try to normalize keratinization by slowing down epidermal basal cell mitosis, while anti-seborrheic works to control the sebum production in the skin. Salicylic acid is a keratolytic, keratoplastic, and anti-seborrheic agent that have antibacterial and antifungal action. Salicylic acid is used extensively in veterinary dermatology to treat many keratoproliferative diseases. The next agent is the sulform. It is a keratolytic, keratoplastic, and anti-seborrheic agent as well. It is also an antibacterial and antipruritic and has a mild follicle flushing action. Resorcinol is a keratolytic agent that also has bactericidal and fungicidal properties. It can be used alone or in combination with other mild keratolytic agents like sulfur and salicylic acid. Benzoyl peroxide is a keratolytic and anti-seborrheic agent that also a strong oxidizer, free radical generator, and antimicrobial, and has been used in veterinary dermatologists for many years. Due to its bactericidal activities, benzoyl peroxide is indicated in the treatment of pyodermas as well as in diseases that causes keratosis. Retinoids. The retinoids have vitamin A activity and act as epidermal growth in the skin when administered orally or topically. Natural occurring retinoids have been shown to protect animals against skin papillomas and carcinomas as well as idiopathic seborrhea in Cocker Spaniel, sebaceous endonitis, canine lamellar ichthyosis, Schnauzer comedo syndrome, and epidermal inclusion cyst. The isotretinoin and etretinate, these two are used retinoids that also have potential in veterinary application and have been used to treat several skin diseases. Isotretinoin is the most effective inhibitor of sebum production known, making it potentially useful in treating primary idiopathic seborrhea and comedo syndromes. Selenium sulfide, an anti-seborrheic, keratolytic, and keratoplastic compound that also has some anti-dandruff activities. It exerts this action by its anti-mitotic activity by slowing cell proliferation and sebum production, and tends to be irritating, especially if used in long-term treatment, and also stains hair. These ingredients is well tolerated by dog but should not use on cats. Coal tar. It has keratolytic as well as keratoplastic and anti-seborrheic activity. Coal tar product should not use in feline due to frequent irritant reaction and increased risk of toxicity. The next group of agents are the wound healing agents. Many topical drugs are used to treat wounds. These may intended to promote natural wound closure, prevent infection, or reduce pain. Here are some wound healing agents: the povidone iodine like betadine and isodyne, sodium iodine, zinc oxide, zinc sulfate, and copper naphthenate solution.